I am a neurologist. I work for a private practice neurology association here in Indianapolis, Indiana. My father is a physician, and he was a big encouragement through medical school. In fact, he was on the faculty where I went to medical school, although he never had me. He would say, look, I know it's a lot of work, but keep at it and it's rewarding in the end. Well, medical school is very competitive. They take the very best applicants and then stratify them across all grade levels. So you really have to be diligent and be on your toes with regard to what you're studying. But it's rewarding in the end. It's a lot of work, but it's rewarding. I did a fellowship in clinical neurophysiology, which was divided into interpreting some diagnostic tests such as EEGs, which look at brain activity, EMGs or electromyograms, which looks at the health of the nerves in your hands and your feet, and also involved in care of epileptic patients and patients with neuromuscular disorders. So probably epilepsy and neuromuscular disorders are what interest me most in neurology. We deal with basically adult neurology, and that's stroke, movement disorders like Parkinson's disease, epilepsy and various seizures, headaches, chronic pain. Well, stroke is, in an adult, it's the leading cause of disability, and it's the third leading cause of death in the United States. And basically things that you look for are difficulty speaking, inability to walk, the person becomes numb or weak on one side of their body, they can't see to one direction. The big thing in stroke is time. Time lost is brain lost. So the sooner you can get treated, or the sooner you can get evaluated, the quicker you can recover to quality of life that you had before the stroke. When I was first starting out, we had a gentleman who came in with a fairly profound stroke. He wasn't able to speak, he wasn't able to move one side of his body. Came in enough time that he was a candidate for one of these interventions that we can offer the patient. And by the time he was discharged from the hospital, he was at least able to talk. He was a little bit weak, but he was a lot better than when he came in. I felt really good. That's one of the things that has motivated me in medicine. Primarily with regard to the medications that we can offer for patients with various neurologic problems and the care that we can give to patients sooner in the course of their illness to help them recover. When someone has an acute neurologic change as far as the brain is concerned, the first thing to exclude is blood, and the best thing to get is a CAT scan, a basic CAT scan. If the technology is available or the technician is available, you can do a MRI scan of the brain, which can detect a stroke usually sooner than a stroke where the patient hasn't bled, but where the part of the brain is dying sooner than a CAT scan can. And then you can do a type of angiogram or a blood vessel test to see where the blood clot is itself and watch for a block in the flow or block in the pathway of that blood vessel. And then based on that, you can consider whether it's something you can go in after or whether you can give some medication to help that clot to dissolve. There are different drugs that are coming out to treat epilepsy, to help control patients' seizures. There are medicines for demyelinating disorders like multiple sclerosis to decrease the risk to the nervous system and to help the nervous system repair and that sort of thing. Well, for the future, I would continue to provide the best possible patient care, and I'm interested in some of the new medications that are coming out, particularly with regard to epilepsy. Imaging techniques improve every few years, allow us to see things in greater detail and sooner than we could before, all of which play into helping patients improve their quality of life. The practice that I'm in has an active research arm, and I am both principal investigator, which means that I'm in charge of research studies, and sub-investigator, which means I'm an assistant in several studies, and I'm particularly involved with a new anticonvulsant, a new seizure medication, which, if it is as successful as its parent compound is, should really help to control seizure activity in previously difficult to control patients. because patients who have seizures, they can't drive for a period of time, they have significant lifestyle modifications because of the possibility of a seizure. So it just greatly improves the quality of a person's life, particularly with the issue of driving. I'd like to know that I'm available, always accepting new patients. There are support groups that can make referrals to our practice. We're in the phone book, we're available on the web. I look forward to any opportunity I can to help patients.